Even though life expectancy and infant mortality rates have improved for most Americans, research has found that some Black and African Americans are at a higher risk than others for a number of health conditions like heart disease and stroke, cancer, and obesity. And while genetics may play a role in certain instances, there are other factors that can have a huge impact on how Black and African American communities are able to manage and treat these conditions. Hi, everyone. I'm Tamika Bickham. I'm your host for today's discussion, coming to you live from the Baptist Health Newsroom. We have with us today 3 experts from the Baptist Health family to talk about risk factors you need to know and what you can do for your health just in time for Black History Month. I'd first like to welcome Dr. Heather Johnson, preventative cardiologist at Kristen E. Lynn Women's Health and Wellness Institute. Great to see you, Dr. Johnson.
Thank you for having me.
Dr. Carissa Falden, family medicine physician at Baptist Health Primary Care. Happy to have you, Dr. Falden.
Thank you. Glad to be here.
And also Dr. Rohan Garjay, Chief of Genitourinary Medical Oncology with Baptist Health Cancer Care. Pleasure to have you, Dr. Garjay. I know that's a mouthful.
Thank you so much for having me.
And thank you to all of you for being here for this really important and timely discussion. Now, before we dive into today's subject, I want to remind our viewers to go ahead and send in your comments and your questions. Throughout this segment, we are here for you as always and happy to answer any questions you may have. Now, let's dive into the discussion. The first question is for you, Dr. Johnson. Now, while heart disease is the leading killer for all Americans, some communities face an even greater risk. So why are the Black and African American communities at a higher risk for heart disease compared to others?
It's a great question. So there is growing research as far as in Black and African American communities, as far as higher rates of heart attacks and stroke, as far as what we define as cardiovascular disease. Key factors we're seeing are higher rates of high blood pressure or hypertension, higher rates of also diabetes, in addition to family history and genetics. There's also growing research in what we call social determinants of health, as far as stress and environment. Also seeing that not all neighborhoods is equal as far as food, as far as healthy food options, physical activity options, that also play a role as far as healthy lifestyle and heart prevention.
Great information. Thank you for that. Now, Dr. Falden and Dr. Garjay, this question is actually for both of you. We've seen in the headlines how certain products targeted towards Black and African American women are actually extremely harmful and could increase the risk of cancer. So what are some products Black and African American women should look out for in order to protect themselves? Dr. Falden, I'll start with you.
Yeah, so there is growing research showing that chemical hair straighteners, like relaxers as we call them, contain lye and other different chemicals that have been connected with uterine cancer and possibly breast cancer. There's also in a lot of different oils, lotions, and different Black products, hair care products that contain parabens, which we know there is some link to cancer with those two, breast and uterine and different types.
Yes, I agree. There has been this recent study which has shown connection between hair straighteners with uterine cancer. We don't know the exact mechanism, but women, especially African American women who use those products more than average, the incidence of uterine cancer has been about 4 times more than the average population. And having said that, the exact chemicals are not well known, but very important to know is patients should focus on exercise, weight management, healthy diet to lower the risk of these kind of cancers.
Wow, some great information there. 4 times higher. Such a staggering statistic there. Now, Dr. Falden, this next question is for you. Obesity is a national epidemic and a major contributor to some of the leading causes of death in the U.S. And Black adults had the highest obesity rates of any race or ethnicity in the U.S. in 2022. Is the Black community predisposed to obesity, and why does obesity affect these communities so much?
So there's a lot of research being done about this, and we do know in general, yes, there is some genetic predisposition to different disease processes, obesity being one of them, diabetes, hypertension. We know that there's a genetic basis there, but also research shows that there are definitely socioeconomic factors that influence obesity too. income level, education level, access to quality food. There's a lot of different food deserts in a lot of communities where there's not access to nutritious, healthy food. And we know that does make a difference.
Yeah, some great points both you and Dr. Garje, and really all of you have brought up around the socioeconomic factors like food deserts, access to places to be able to exercise adequately, access to healthy food. If you find yourself in one of those communities, let's say a food desert, what can people do?
So yeah, that's difficult because a lot of times these food deserts don't have fresh foods, but sometimes going to the frozen food aisle, so frozen broccoli and frozen vegetables are often pretty nutritious and are very dense with different healthy kind of things that we want to find in food. So I think that might be a good alternative if you can't necessarily always find fresh foods.
Wonderful. Thank you for that. Now, Dr. Johnson, we know that the Black community is at a higher risk for also developing heart disease, which can put them at risk for other health conditions. So can you tell us about those other health conditions and what are some ways to reduce the risk of developing heart disease?
Thank you, Tamika. So yes, heart disease, when we talk about it, one of the most common are heart attacks. But unfortunately, in Black and African American communities, there is twice the risk of developing heart failure. That can be a weakening of the heart muscle, enlargement of the heart muscle that can limit as far as blood flow, increased risk of abnormal heart rhythms. And also there's a much higher risk of stroke in the Black and African American community. So yes, other conditions can definitely take place. Now, the good news behind all of this is that you're exactly right. There are things we can do to help decrease that risk. Prevention, lowering sodium, lowering salt are absolutely key. And so, as was just said, as far as also if we can limit canned foods or those higher sodium foods, going more towards frozen foods, limiting also as far as even with canned foods, there may be at least lower sodium options, if not no salt options too. Also monitoring cholesterol levels as far as limiting fried foods and maybe going more for baked or grilled foods as much as possible as far as physical activity. Also close monitoring as far as blood pressure, cholesterol make a really big difference. So the exciting thing is that prevention is key and it's never too late to make changes.
I also like that you brought up the point around monitoring. I know something we've had this discussion on this show before around, hey, those of us in the Black community tend not to pay attention to those important health statistics, health numbers, or just, go for our regular checkups that we need to do. Any kind of words of advice or, thoughts around that and what we should be doing for our overall health and wellness on a regular basis?
We love to highlight the importance of not just our annual physicals, but ongoing monitoring regarding our heart health. Many of us may have our blood pressure, cholesterol, or blood sugar checked, but that ongoing follow-up is key. We're also raising awareness of the importance of monitoring our blood pressure at home if possible, maybe even borrowing a cuff or even checking it at the pharmacy. We're noticing that blood pressure can be higher at times and it may not be in the clinic. And that can go a long way in decreasing risk of heart attack, heart failure, and decreasing risk of stroke. And so we're encouraging not just having the initial checkup, but also if recommended, the prescription medications, working with your team as far as the best medication options, if that's recommended for you, understanding the benefits that those medications help decrease our risk of heart attack and stroke, and making sure that you're monitored really closely. And that's what we're encouraging. Also staying in close touch if there are any issues and not just waiting for that next scheduled visit.
Some great points I like that you brought up there around the fact that your blood pressure may not be, it may be one thing when you're at home and another thing when you're there at the doctor's. So certainly some great incentive there to keep an eye on that and monitor it on your own time as well, because knowledge is power. If we don't know, we can't help improve our own health, right?
Exactly. There's also a big focus of people wondering, what does physical activity and exercise mean? And we say, listen, get moving, get active. It doesn't mean you have to join the gym. If walking is possible, that's wonderful. 150 minutes per week, 30 minutes, 5 days a week is a great goal for everybody, for all of us, just for general heart health. And so if you're not able to physically walk or go out for exercises, even chair movements can be key. Floor movements are important. So please just stay active and keep moving.
30 minutes, 5 times a day.
5 times a week.
I'm sorry, 5 times
You
a
bumped
week.
it
Yeah, 5 times a day wouldn't be that attainable, but 5 times a week is certainly something that's doable. Thank you for that. Dr. Garge, this next question is for you. Some people might be surprised to find that Black and African American men are nearly 2 times more likely to be diagnosed with prostate cancer than others. So why is this, and what other cancers are Black and African American people at higher risk for? And what are those risk factors?
Yeah, it is a rising concern. With me as a prostate cancer expert, I have seen, a higher incidence of prostate cancer in Black men. The other risk factors being age and and family history of cancers, where there are some genetic factors such as various mutations called BRCA mutations, which predispose people to get cancer. Now, there are various factors, be it screening access, which limits the diagnosis in some patients at an early stage. At the same time, we have noticed recently, American Cancer Society has released a new data which actually showed that there has been overall increase in advanced cancer in prostate specifically, which is primarily because changes in the screening pattern, be it due to relaxed screening rules for prostate cancer, decreased discussion between the patient and the physician for screening. And most recently, we have seen COVID has really impacted the screening discussions as well. So overall, in African Americans, we do see, because of various genetic factors, that it could be a higher risk. It's not only higher risk of incidence, actually, it's higher risk of mortality, compared to other races. So it's very important to be mindful. And the biggest thing which I always discuss with my patients is it's very important to have a shared discussion with the patient and their primary care regarding screening, especially men who are at high risk with family history should always discuss with their primary care doctors about the risk and benefits of prostate cancer screening. Now, the same thing goes with other cancers. Relatively, in Black women, the mortality risk of breast cancer is much higher than white women. Is it again because of decreased screening and diagnosis at a later stage, which presents them at a higher risk, is the main concern? So it's again, there are very good screening tools for breast cancer, where it can be identified very early, and by following various protocols, we can identify the cancer early, treat, and then hopefully cure the cancer. So it's very important to be very mindful about the screening options, identifying people at risk for cancer very early, and we can cure those cancers. Now, to add to the additional factors, there's a huge amount of literature now available, even in cancer world, that regular exercise, high intensity exercise is really helpful. In fact, all my prostate cancer patients who I see, who actually regularly exercise, who perform high intensity exercise, tend to be more stronger, more better in their quality of life, and actually live longer. Their responses to cancer treatment are much better when they exercise regularly. And it has actually recently been proven in multiple studies. So that is another various among all benefits of exercise, be it cardiovascular reasons, but also from cancer perspective, by preventing and also better treatment, it really helps the patients.
Thank you so much for sharing that information. It's definitely can be difficult to hear that, hey, in cases, like you said, prostate cancer, where incidents are not necessarily higher, it's the mortality rate that is higher among Black and African Americans. But really, the positive side of that is that a lot of this, as you're telling us, seems to be due to a lack of those screenings, which means there is some power and control that we can have and take back into our hands about being proactive with our health.
I totally agree with you. The biggest take-home point is, people should be mindful about these screening cancers and discuss with their doctors. and ask about PSA screening, mammogram, pap smears, colonoscopies. These are all very good tools to identify cancer early and take care of them at an early stage.
Now, Dr. Falden, this next question is for you. The severity of asthma tends to be worse in the Black community compared to others. Why is that? And are there certain environmental factors that can increase the severity of asthma?
Yeah, so we definitely know that there are many different components to why that statistic is true. And one is exposure, like asthma is triggered by a lot of different allergens. And so if someone's, home is maybe more predisposed to mold or, the quality of air isn't as good, then that's going to trigger more asthma. We also know that there is a component of access, to different medications and controlling asthma symptoms, and also the health literacy behind that, making sure that children, their parents are aware of how do we prevent asthma attacks, how do we regularly control it, and even adults, taking their medications regularly and understanding that, I need to control my environment a little bit, whether that's putting in air filters in the home or avoiding, smoky areas, like that's also really important too.
Great information there. Thank you. Now, I want to go ahead and check for our viewer questions. I know we have a question here. So one question from a viewer is family history a good indicator of what I can expect health-wise? Who wants to take this one?
I can start, that's fine.
Yeah.
It's a great heart health question. And so family history is just one of what we call risk factors for particularly heart disease, but it does not guarantee that you yourself will develop heart disease. And so to really highlight today's focus, preventive screening, close monitoring, heart healthy lifestyle makes a really big difference. So many other factors contribute to the development of heart disease, but it's not a guarantee at all. And so we say, don't think that what happened to a relative will definitely happen to you. Let's work together as far as prevention.
Yeah, absolutely. And just to piggyback off of that, knowing your family history is extremely important. It also changes sometimes the way we do certain screenings. So, an example is colon cancer. If you have a first degree relative that had colon cancer, you're going to be screened a little bit more frequently than the average population. So, knowing your family history can help prevent, some diseases or catch them earlier as long as you're aware of it.
And I do want to follow that up with another question, Dr. Falden, because oftentimes in our communities, we're not necessarily having these discussions with our family members about family history. So do you have any tips on how to open up that conversation with family members so that we can gain more insight into their health background?
Yeah, that is a little bit complicated because there is sometimes a lot of fear around health, and that makes it having that conversation sometimes difficult. But sometimes if you can't reach out to your mother or your father, there are oftentimes family members that you feel closer to that might know a little bit of the family history and diseases that have happened, especially cancers and diabetes, heart disease, those kind of things that they will know. And so I think that coming from a very genuine place and honest place of taking control of your own health and approaching, your family members like that sometimes opens that door a little bit more, decreases kind of the fear level.
Absolutely. Thanks for sharing that. This has been an absolutely wonderful, important conversation with all of you. Now, before we go, I want to ask each of you for one tip or piece of advice that you give to patients in this community to empower and educate them about taking charge and staying on top of their health. Dr. Falden, I'll start with you.
One piece that's kind of hard. I would say that, following up, like getting a good PCP, a primary care physician, is so important because they're going to be like your contact point into all aspects of healthcare, and, also knowing your numbers and knowing where to go. And it's a good starting place. So I think finding a really good PCP to follow with is really important.
Great tip. Dr. Garjay?
Yeah, but one single line advice would be, exercise. If folks can, focus on their health by regularly exercising, especially in the cancer world, I have clearly seen that, people who are very, we rarely see people who are extremely fit and active in our clinic, which indirectly tells me that, that is a testament that, the risk of cancers is very low in people who exercise regularly. So, and there is a huge amount of evidence that people who exercise and remain active are at lower risk of cancers in general. So exercise is the key.
And Dr. Johnson?
I always say it's never too late to have a heart health check. We work very closely as far as with primary care physicians, oncologists, to really help people understand their individual risk for heart disease or to also prevent another heart attack or stroke. So take time for yourself.
Absolutely. And I will add and reiterate, even though it's already been said a few times during this conversation, we can't say it enough to stay on top of your routine screenings and appointments, and also make sure you're implementing healthy eating habits and daily exercise. That 30 minutes, 5 times a week, not a day. So definitely attainable. Thank you all for sharing this insight with our audience. And to our viewers, remember, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. You can also connect with us on our social media channels. We're everywhere. You can find us on Facebook, Instagram, Twitter, TikTok, and also LinkedIn. And check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, stay safe, stay healthy, and thanks for watching.